Hello Jokers, thanks for watching this episode of Jawkers Physiotherapy. Today I wanted to share with you the reasons for clenching and teeth grinding. So I can think of 4 reasons that I mentioned to my clients about the reason for teeth grinding and clenching. First one, and that the top one will be the posture. Within posture, we're talking about Dowager's hump, which is it's famously known as the hunchback of Notre Dame. You know, that hunchback in the back of the neck. Basically, it means your head has shifted forward. Now, when the head shifts forward, you'll probably notice your teeth tend to come together. Ideally, we want our teeth to be apart. But when the head goes forward, the teeth tend to come together and you may clench more during the day. Now, I'm on a firm belief that what we do during the day is repeated in our sleep. So if we can change what we can change during the day, that will reflect in our sleep. So changing the posture during the day, especially, you know, these days we could be sitting in front of the computer for a very long time. Our neck could be just, poking out towards the computer screen or a smartphone that may be placed quite far below instead of in front at your eye level. When you sustain the postures like that, obviously that's very, very heavy. Your head is very heavy, and it can affect your posture and therefore clenching when the head is forward. Okay, obviously that can contribute to other conditions such as upper neck pain, neck pain, headache, and so on. Second one is the jaw itself. The jaw itself can cause problem. You can have clicky jaw, popping, and obviously with more clenching, it puts your jaw through more stress. Now, when you clench and grind, it can be as strong as 125 kilograms of force in the back teeth, and maybe 25 kilograms of force to the front teeth. So you can imagine small joints in your jaw getting 125 kg of force maximum. Of course, it's going to affect your jaw joint and starts to disrupt your jaw joint over time when you're grinding day in, day out. Thirdly, sinus issues or nasal passage. What does that mean? So it relates to how you breathe. Now, I often ask, is your nasal passage clear? This relates to where your tongue sits. Ideally, we want the tongue to be on the roof of your mouth, sitting in the alveolar ridges, which is just behind the top front teeth. If you roll your tip of your tongue off the front tooth, the top front tooth or teeth, and then roll it back, there's this rough surface called the alveolar ridges. The tip of the tongue should stay there most of the time. And with your teeth apart, lips sealed together, and then breathe through your nose. And that should be the resting position during the day, and that should help keep, breathe through your nose, which obviously keeps your oral cavity moist. Why is that important? Because if you are a mouth breather, which means your tongue seems to stay on the floor of your mouth, the bottom of your mouth, it tends to push your bottom jaw forward, distorting your jaw mechanics, bringing your teeth together and therefore clench more possibly. But also it can dry your mouth because you're breathing through your mouth a lot more than through your nose. Now, dry mouth tend to link and trigger clenching as well. Possibly because you have drier mouth, so you salivate more, and then the saliva you need to swallow. Now, when you swallow, you clench your teeth together. You try. When you swallow your saliva, you bring your teeth together. So more dryness, more saliva production, more swallowing, more clenching, possibly. And then the fourth one is the reflux, or known as GORD, gastroesophageal reflux disease, or GERD. If you remove the O to write esophagus with E, GERD, basically there is a strong link to the high acidity in your stomach and clenching through the night. And it's been shown that if you take antacids such as some products, Mylanta or Somac or other PPIs, it seems to reduce the acidity in your stomach, and that can help reduce clenching in your sleep. So they're the 4 things, and obviously the top 3, definitely we can help with the physiotherapy program, not so much with the reflux. Possibly we can help because it can be related to your upper neck through vagus nerve innervating your stomach. So improving your upper neck condition, it may reduce stress to your vagus nerve, and therefore less stress to your stomach through reduced acid production. Who knows? These are all in theory in terms of the reflux condition thing that I just said, but things that we talk about in our consultations, and that seem to make a bit more sense to people who have been putting up with teeth grinding and clenching. And we can modify the top 3 conditions mechanically through rehabilitation. So if these factors ring a bell, maybe seek help from your local physiotherapists who have special interests in jaw problems or things like that. And thanks for listening. Thanks for watching this episode of Jawkers Physiotherapy. And if you like this video, please give me a thumbs up, and please subscribe so that you'll get notification for more videos. Okay, happy rehab. Cheers. Bye.